Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, while new COVID-19 cases in Metro Manila slowly decline, the health department says it's too early to downgrade the region's alert level. The health department announces new guidelines on the more inclusive COVID allowance for health workers, but some groups say the policy is discriminatory. And later, scientists are now looking into a new subvariant of Omicron. Health spokesperson and undersecretary Maria Rosario Vergeire joins us live. The health department says it's too early to tell if Metro Manila is ready to shift to a more relaxed alert level next month. The DOH adds new COVID cases have yet to peak, which is projected to happen by the end of January or even mid-February. While the capital region is showing a steady decline in new cases, some nearby provinces are showing COVID-19 surges. Let's go straight to the source of the story. We have health spokesperson and undersecretary Maria Rosario Vergeire. Yusek Vergeire, welcome back to The Source. Maraming salamat po sa inyong oras.
Magandang umaga po, ma'am, and good morning to all of you.
So we recorded a little over 30,000 cases Saturday and almost 30,000 cases last Sunday, basically, which was yesterday for the whole country. I just want to first talk about the cases in Metro Manila and kind of make sense of the numbers we're seeing. 5,433 cases were recorded Sunday in NCR. That's down from 9,400 about 4 days ago. So are things looking up for NCR?
Yes, ma'am. No? So when we try to look at our numbers, our 7-day moving average right now for the National Capital Region is about 8,676. If you compare that with the previous week 7-day moving average, it's 17,000 plus for the previous week. So we are seeing a slowing down of the increase in the number of cases in Metro Manila. But we are still very cautious because we know that there are a lot of individuals that are using antigen tests at home and even in the local governments that are not being reported to the DOH. And also there are a lot of individuals currently who are sick, opts to isolate and without being tested. So these are the things that we are looking at. But definitely, cases are slowing down in NCR, but in the other regions, it is now increasing.
I understand. Obviously, marami ho sa atin either nag-antigen test at home or even sa mga clinics. However, just to be clear about this, yung pong mga nag-antigen ho ba sa clinics or labs, are they required? And is this counted sa daily infections natin or hindi pa rin kasama ang mga antigen tests still now?
Until now, we have not included this as part of the reported cases, ma'am, because one thing that we have found out with all of these submissions to us, actually, we already received about 1 million to 1.2 million submissions since March of last year. But when we try to validate all of these submissions, only 30% will come out to be accurate and based on protocols that we have set forth. So we cannot include it as of this time, but at least we have these trends that we use so that we can use it for internal guidance and planning.
And basically, really, the antigen test right now is to be able to identify those areas where residents are positive and do the granular lockdowns. Basically, that has been the direction of government with regards to antigen tests.
Well, yes. When we had the Delta experience, we really used antigen so that we can do active case finding, and then we can be able to lock down an area if there are clustering of infections. But right now with Omicron, what is being done would be that every time that people would have symptoms or they get exposed, since there had been this kind of challenge with our laboratories, they opt to have their antigen test at home or be done with our medical clinics. And unfortunately, we don't get to see this kind of results coming from them.
So have we actually, would you say we've reached the peak in Metro Manila?
Well, if we look at our numbers right now and basing this from comparison, comparing this from the previous week, looks like that we have reached that highest number of cases here in Metro Manila, and slowly cases are going down. But as I have said, we have to be cautioned because we do not have the complete picture here, because we have not seen those using the antigen and those individuals that are having symptoms or had been exposed and did not have any test at all.
Yeah, but the thing is, no, Yusek, you'll never really see the records of those. Yung mga hindi po nag-antigen at nag-decide na lang kung mag-isolate sa bahay dahil nakaramdam ng mga symptoms, at yung pong mga nag-antigen sa bahay, hindi naman po nare-report yan. And then even those who may have done antigen in clinics, also those are not reported. The point I'm trying to make is that we'll never really know how many. This is really an underestimation of the infected cases we have in Metro Manila.
Yes, ma'am, actually. And that is one of the things that we had been very transparent from the start. We have projections that we use done by our experts and the FASTER team, wherein there is this certain percentage that we use based from the assumed, based on the models that we have done. And it's about 30 to 40% that are not being detected actually for now. But as I've said, yes, we have seen that cases are slowing down and cases have reached the highest numbers, and we are seeing a slow decline in NCR from this, comparing from the previous weeks.
And with that said, what about the de-escalation of Metro Manila? What are the indicators that will move us one step more lenient or less strict?
Well, for now, it's still really based on the metrics that we use. We know that we use the 2-week growth rate and the average daily attack rate. And also we look at the healthcare utilization. So for now, for NCR, we still have a very high average daily attack rate. So this means that these are the new cases that are affecting the population for every day or for a 7-day period. And for now, the average daily attack rate is still at 90 plus. And then the 2-week growth rate is still very high. And Metro Manila, NCR, there are hospitals which are on critical risk utilization for their hospital beds, and we are now at moderate risk. So basing on these different parameters that we use, I think it is still very early for us to say that we can de-escalate NCR as of this time.
Okay, so dun sa mga nagtatanong, just to be clear about that, kung bababa po tayo ng alert level by February 1, you're saying right now that that doesn't look, it doesn't look likely na mangyayari po yun.
Yes, ma'am. So we still need to closely monitor, and of course, we still need to decongest our hospitals before we will be able to really decide to de-escalate Metro Manila or NCR to alert level.
Okay, I hope you don't mind. I would just want to go back to the antigen test. Something very interesting you said that I believe you said from March of last year, meron pong 1 million antigen test results. Sino ho ang nagsasubmit nito? Is there a mandate among clinics or even labs doing antigen tests? Let's take away the home test, no, Yusek. Yung gumagawa po ng antigen test sa mga clinic at sa labs, meron ho bang protocol na kailangan isubmit po ito sa DOH?
Yes, ma'am. There is this protocol that our laboratories, the clinics, and the local government should submit to us the results of antigen tests that they use. Unfortunately, compliance has been very low since the start that we have implemented this measure so that we can get completed reports. So hanggang sa ngayon po, nakikiusap pa rin tayo sa ating mga local governments, and now we also would like to explore that mechanism where citizens would just chat into this system that we have, yung Kira chat box, so that we can also have a sense of how much antigens are being used in our homes.
Right. It's also good to find out, while the cases in Metro Manila are slowly decreasing, mataas pa rin po yung mga kaso natin at 30,000 the past 2 days, because in other areas, the number of infections have actually been increasing. We'll talk about areas of concern outside Metro Manila, but we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, health spokesperson Maria Rosario Vergeire. You said let's talk about areas outside Metro Manila. Which are the areas of concern right now?
Well, for now, ma'am, if you look at our trends, we can see that all regions of the country are having this increase in the number of cases. It's just the NCR because we started earlier, but right now all the regions, no, we have about 13 areas. Critical risk case classification, and there are only 4 areas with high risk case classification in the country. And then also we are closely monitoring specific areas because their healthcare utilization is really increasing. We have CAR area. We also have Region 8, whereby we are really having this close monitoring because of their facilities.
Yung pong CAR, nasa certain areas in CAR are already on alert level 4.
Yes, ma'am. We have escalated 2 of the areas in CAR last week into alert level 4. And right now, we are really closely monitoring. A problem with CAR would be the lack of or the inadequate number of hospital beds. Kaya konti lang po na pagpasok ng mga pasyente, madali pong napupuno ang kanilang mga ospital.
Meron pong, there is, Senator Gordon during an interview was actually pushing for saliva tests, no, to be done in the provinces. In fact, he went as far as advising the DOH to use this instead of the antigen tests. Is government inclined to do this? And maybe just as a follow-up question, bakit ho kaya yung saliva test hindi masyadong nag-take off?
Yung saliva test po kasi ang nag-offer po niyan talaga would be Philippine Red Cross. They were validated by our ITM. Tapos nagkaroon naman po ng parang guidance and collaboration between DOH and the Philippine Red Cross. Ayun pong mga ibang laboratories, they did not opt to have this saliva as specimen na gagamitin na test po. No? Unang-una kasi, yung sensitivity nitong saliva as specimen is much lower than that of the nasal swabs and the nasopharyngeal swabs na ginagamit sa RT-PCR. Ngayon, ito pong ino-offer ni Senator Gordon, it is workable naman po and acceptable kung gagamitin po dun sa ibang areas like PRC laboratories are, in every region of the country, marami na po, no, most of their laboratories. Pero itong antigen po kasi, very useful ngayon yan sa ating mga communities kasi ang antigen is most accurate when you have symptoms. And a lot of individuals right now are having symptoms. In a few hours kasi, you get the test already and you can be able to manage the case already. That's why antigen test is being used and pushed by the Department of Health right now.
Kumbaga, it's an easier and faster method, ano po. Pero what Senator Gordon, I believe, is saying that he's pushing for the saliva test because the antigen has more chances to either give you a false positive or a false negative. But I do understand what the DOH has been saying all along, that antigen tests are most accurate when done when you have symptoms.
Yes po, ma'am. Tama po yun. No? So, actually, tama naman yun. Meron tayong caution sa ating mga gumagamit niyan because of misuse really. When you use it for screening, yung antigen test, you use it when you do not have symptoms, talagang baka magkaroon ka ng mga false results dyan. And that is something that we instruct our local governments and even the citizens, advising them about that. Ito naman pong kay Senator Gordon, yung sa laboratories ng PRC, that can be an option for us and it's going to really help, no, dun sa mga areas especially na talagang mahirap po maka-access ng laboratories.
Opo. Any update on plans to lower possibly the prices of RT-PCR and even antigen tests?
Yes, ma'am. No? So there had been this series of meetings already because we have this sub-technical working group under the IATF on price caps. This is between the Department of Trade and Industry, the Department of Health, and other stakeholders that we have. No? So pinag-aaralan na ho ngayon yung existing or yung current na mga pricing and the range of prices so that there can be a scientific estimate kung magkano po ang dapat na price cap ngayon ng antigen test at saka ng RT-PCR test. So siguro po in the next weeks, we'll be able to issue already a revised price cap for these two commodities.
Okay. So we can expect na mas bababa po yung prices ng RT-PCR and antigen tests. I want to go to this news that I read actually just yesterday. I read this just kahapon po, no, yung tinatawag na subvariant ng Omicron. I was actually surprised by this because there is that subvariant, I forget what it's called, B something point 2. Ano ho ba to? And is this more infectious at mas magkakasakit ho ba ang tao with this stealth subvariant? Stealth is the subvariant of Omicron.
Actually, ma'am, nung atin pong lumabas yung Omicron, when Omicron was being reported already, after siguro mga 1 week, lumabas na po yan. Yung report na yan that there is this another sublineage of this Omicron variant and they call it BA.2 and this is the stealth Omicron, ang tawag po nila. This came out in some of the areas in Europe kung saan sinasabi nila it's overtaking the detections of Omicron na ito na yung kanilang subvariant na nakikita. Now, WHO as well as other experts across the globe are studying this stealth, Omicron or subvariant, and they're saying that based on their initial findings, sa mga initial po nilang pinag-aaralan and based on observing the patients who had this kind of subvariant, wala namang masyadong difference with the Omicron as to the severity of illness, pero kailangan pa daw pag-aralan maigi. So it's WHO that we will wait for if they will classify this as a variant of interest or concern.
Isn't it a variant of interest right now?
Sa ngayon po, kasi nga pinapatuloy po yung pag-aaral, so yung WHO pa rin po ang magsasabi sa atin if it's going to be a variant of concern.
Okay, and just to repeat that, you're saying that doon po sa mga studies na nag-positive po dito sa stealth Omicron subvariant, it didn't show that in terms of severity it was worse than Omicron. But did it say anything about transmissibility? Because we know ang bilis po makapanghawa ng Omicron. What about stealth?
Yes, ma'am. So that's what I've said. So base po dun sa initial na pag-aaral at saka observation among patients who had this, hindi pa ho kumpleto yung kanilang pinag-aaralan if it's going to be more transmissible o kung mas ano ba siya dun sa escaping the immunity. What they know right now would be the characteristics as to causing illness or symptoms is not so much different from the Omicron and doesn't cause that much severity among the individuals.
I see. Do we have the capacity to actually detect this stealth Omicron subvariant?
Yes, ma'am. Yes, ma'am. We have the capacity in our Philippine Genome Center when we do our whole genome sequencing, all the possible lineages that are present in every sample that we get can be detected. So hanggang sa ngayon naman po, wala po tayong nadidetect na ganitong BA.2 dito po sa ating bansa.
BA.2 or the stealth Omicron subvariant. So far, wala pa pong nadidetect dito po sa bansa. Let's talk about the healthcare workers allowance. After the break, papalitan na po itong tinatawag na SRA at MAT, yung meals, allowance and transportation, to what is going to be called the One COVID-19 Allowance. Who will be eligible? We'll be talking about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, health spokesperson and undersecretary Maria Rosario Vergeire. I wanted to clarify this One COVID-19 Allowance, Yusek. Papalitan na ho ba nito yung SRA, yung insurance, at yung tinatawag na MAT, which is meals, allowance, and transportation?
Yes, ma'am. So actually, this move or this policy is really just to streamline everything and to make more the transactions that we be efficient. If you notice before, we compute and try to verify all of these submissions for specific benefits. What we did, without having to reduce the amount that we give to our healthcare workers, we just made it as one. So this is called the One COVID Allowance or the OCA, kung saan we have these risk classifications according to the risk exposure of every healthcare worker in the country. We would still give the same amount because in the previous, we give SRA at 5,000, we give the active hazard duty pay at 3,000 and the other benefits. Right now, we just had it as one. So we'll have the high risk classified as high-risk healthcare workers, and these are those in our hospitals, in our laboratories, in our TTMFs, they will receive 9,000 per month. And then for the moderate, they would receive 6,000. And then for the low risk, they would receive 3,000. So wala pong nabawas. Pinag-isa lang natin para mas madali po at mas magkaroon po ng regular na pagtanggap ang ating mga healthcare workers without having to wait because of all of this validation that we are doing when they submit their lists.
Is this also dependent on the number of days that the healthcare workers actually go to work? Because you were saying that for high risk, it's 9,000, medium risk, it's 6, and low risk is at 3,000. Meron ho bang number of days na kailangan po silang ikumpleto para pumatanggap ito?
Yes, ma'am. No? So there is still this criteria kung saan meron ka dapat average or maximum na number of days na dapat na andun ka para matanggap mo ito. Pero hindi po katulad dati na kino-compute pa natin sa bawat oras na ipinasok mo. This is now going to be a regular, a benefit for our healthcare workers, but of course still depends if you went to office or not. Baka hindi ka naman nakakapasok, so you will not be entitled to this kind of allowances.
Ang sabi lang po ng Alliance of Healthcare Workers, this is discriminatory. Why categorize high risk, medium risk, and low risk? Please respond to that, Yusek.
Yes, ma'am. No? So, hindi po ito discriminatory kasi kailangan talaga naman natin mabalikan. What is the objective of giving these additional benefits? We call it a special risk allowance because we know that because of this pandemic, our healthcare workers have this additional risk to them. And this risk should be classified kasi meron ho tayong healthcare workers that are really not on the front lines. Katulad po ng mga taga-DOH, sa opisina po kami, so hindi ho kami high risk talaga. Yun pong nasa regional offices namin, nasa opisina rin, meron lang mga iba na talagang bumababa at nagpupunta sa field. So that's high risk. So that's why we did that. Pero hindi po ito, we did not, no purpose or no intention to be discriminatory because of it's just classifying the risk of each of these individuals.
Let me also just add, Yusek, there was a news report that I read wherein Congressman Defensor was actually urging the DOH to comply with what he said was a Malacanang order, I believe last year, signed by Executive Secretary Media Aldea to increase the basic salary of nurses by about 3,000. Any update on this?
Actually, pagka mga increases po, kailangan po namin ng pakikipag-usap sa DBM. And we are continuously discussing this with DBM based on the budget that we have right now. So we will give information if this can be accommodated into our current budget because as of this time, sa benefits pa lang po ay talagang naghahanap pa rin kami para po mapunan natin lahat because some of these funds are still in the unprogrammed funds na binigay po sa atin.
Antigen home test kits. This needs to be talked about. I understand already that this has to undergo a review by the FDA. From the FDA, ipapasa po sa RITM, and then from RITM, ipabalik po sa FDA. Just so we have we understand this issue more, ito pong tinatawag na antigen home test kits that has not been approved by the FDA. Ito po yung tayo po yung gumagawa sa ating mga bahay. Hindi ho ba? It's not the ones that obviously that are allowed in certain clinics and laboratories na meron na pong approval ang FDA.
Tama po yun, ma'am. So kailangan naiintindihan ng ating mga kababayan, may difference po yung currently available sa market natin na rapid antigen test at saka yung tinatawag na self-administered test kits. Yung kung currently available sa market natin, kailangan healthcare worker guided po. Kasi kapag nagkakamali kayo ng collection ng specimen, magkakaroon kayo ng false results kapag ganyan. So dapat very careful. Now, this self-administered test kits is way parang easier for our citizens to use kasi hindi po ganun kalalim ang kailangan kunin na specimen. Nasal swab lang po siya, so mababaw lang sa nose. But the DOH will release instructional materials for our citizens para guided po kayo kapag ginagamit nyo yan.
Yeah, we need that. When do you expect the guidelines to come out? And just to follow up on that, when kaya papayagan na o magkakaroon ng approval mula sa FDA itong home test kits or self-administered test kits?
Yes, ma'am. Actually, final stages na po tayo no, doon sa evaluation because our ITM's performance validation is the most critical. Kung saan nakapag-evaluate na po sila ng 2 among the 11 which applied at nasa FDA na po ngayon for them to do the final evaluation. Maybe in a couple of days lalabas na po yan no, kung ito po ay pumasa sa standards. Yung guidelines po ng DOH, finalizing na rin po kami and we will issue it according in parallel to FDA para maari nang magamit pag lumabas na po itong registration ng FDA.
Pero Yusek, is it possible or would I be correct to say that the ones being administered by healthcare professionals na mga antigen test kit would probably be the same as the posibleng i-approve ng FDA na self-administered test kits? Yung po mga branded na yon?
It's different. It's different. As I've said, yung atin pong rapid antigen test ngayon, specific po nakalagay yun dun sa kanilang labels at saka dun sa kanilang specifications that it's really supposed to be guided by healthcare workers. Iba ang specimen na kinukuha and the manner of how you get it as compared to this self-administered test kits. Specific po yan sa label niya. It's really for home use and the specimen will be different also.
I see. Okay. Just one point one issue I also wanted to raise with you. Is it true, Yusek, na that a more severe strain is highly to develop? Hindi po, a more severe strain is not highly to develop dahil po sa Omicron variant at dahil po nagkaroon na rin po tayo ng 4 na strains in the past. Ang sinasabi ko kasi ni Father Austriaco, it is less likely and near impossible that a more severe strain could actually develop. Is this true?
Nobody can say that. Actually, even the experts across the globe are saying, even WHO is saying, although we are seeing that, for example, in Europe, almost 60% of their population might be infected. So baka mahaba-haba ang panahon para magkaroon uli ng panibagong pagtaas ng kaso. Pero as to the variants of interest and concern, we are not really certain, and we cannot say that there are no more highly infectious variants that will come. Always remember na as long as the virus has a host, it can still multiply, it can still mutate. So that is the sad part among viruses. Ito yung cycle nila, they can always mutate. And we don't know if they can be able to still mutate into this highly infectious, highly transmissible variant. So we still need to be very vigilant with this. There's no telling. We have to be vigilant.
Yes, of course. And as you always mention, always still be cautious. Health spokesperson and undersecretary Maria Rosario Vergeire. Ma'am, maraming salamat po sa inyong oras.
Thank you very much po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.